Good morning, everyone, and welcome to the Brooklyn Fire Station. We are here this morning to announce and kick off the latest initiative by Anne Arundel County and the City of Annapolis to combat the growing heroin and opioid epidemic in Anne Arundel County. As you may have observed on the sign out front of this station, the county has experienced 354 overdoses and 35 deaths from opioids year to date. This reflects 100 more overdoses than this time last year. This morning we will hear about the new program from Anne Arundel County Fire Department Chief Alan Graves, Anne Arundel County Executive Steve Shue, Annapolis City Mayor Michael Pandelides, Anne Arundel County State's Attorney Wes Adams, and Anne Arundel County Police Chief Tim Altamari. We will be happy to take questions following their statements, and most will be available for questions following. At this time, it is my pleasure to introduce Fire Chief Alan Graves of the Anne Arundel County Fire Department.
Good morning. I too also want to welcome you to the Brooklyn Fire Station. This is just a representation of the 31 other fire stations that we have in the county that will be available for this program. Today we're here to kick off the Safe Stations program. This program will give members of the community a place to go to seek help for heroin and opioid addictions. All fire stations in Anne Arundel County and the City of Annapolis will be designated as safe stations. The community can also go to any Anne Arundel County or City of Annapolis police station to seek similar help. We were made aware of a similar program in Manchester, New Hampshire, and thought that it would work well here. Fire stations are normally the hub of a community and are places that people are comfortable going to. This makes them ideal as a source of information and help for heroin and opioid addiction. To make this possible, we needed to bring a number of different county and city agencies together. Through the help of the people standing here, we have been able to make this happen very quickly. While you'll hear from some, I wanted to acknowledge several. First, President Adam Inola of the Anne Arundel County Professional Firefighters and President Tim Hall of the Anne Arundel County Volunteer Firefighters Association, whose members are on the front line of the overdose crisis every day. Dr. Wendell, who's our fire department medical director. He's helping to ensure that people seeking help are screened for underlying health issues and to keep them comfortable as possible. Fire Chief David Stokes and Acting Police Chief Scott Baker for working with us and mirroring the program in the City of Annapolis. As you know, sometimes it's hard to tell city fire stations from county fire stations. This means that people can go to any station within the county and be able to seek this help. And Jen Corbin, who's the director of the Crisis Response Team, and they're the link between people seeking help and the community resources that are available. And Dr. Chan, the county's health officer, who has made available all the resources of her department to make this program a success. And last but not least, Kevin Afton, the county's emergency manager, who is coordinating the county's efforts. Safe Stations is the newest program in Anne Arundel County's fight against this deadly epidemic that is gripping the country. Now I'd like to ask our County Executive, Steve Shue, to the podium for a few words. Thank you.
Good morning, everyone. Thank you for being here today. I want to start out by acknowledging our public safety personnel who are present, the firefighters, particularly the members of 31, thank you for hosting us here today. Our police officers, crisis response, EMS, the EOC personnel that are with us today, and of course the addiction services people who are here. And all of these folks working so hard every day in our community to keep this community safe and to help those who are facing emergencies and who are suffering from addiction. Heroin and other opiates are an immense challenge for our country, for our state, and especially for Anne Arundel County. We are being hit very, very hard. When I came into office 2.5 years ago now, we were facing a fatality a day, one fatality a day, and one overdose a day. and 1 fatality a week. That was the basis for our declaration of a public health emergency pertaining to opiates. We immediately formed a heroin action task force. That task force studied best practices all over the country, developed 35 different recommendations, each and every one of them implemented. And those recommendations fall into 3 broad categories and represent our 3-pronged assault on opiates in this community. The first is enforcement. We have doubled the budget for the drug diversion squad in the police department. We have funded a dedicated heroin prosecutor in State's Attorney Wes Adams' office. You'll hear more about that. And working with the sheriff of Anne Arundel County, we are prioritizing heroin-related warrants and getting those people off the streets. Treatment. We have opened a new treatment facility in Mid-County. We've increased community grants to providers of addiction services by 25%. We've doubled the budget for crucial tools like Narcan. We are now offering Vivitrol treatment in our detention centers, and we're working with Baltimore Washington Medical Center on their overdose survivors outreach program. That's partially federally funded, and we thank our federal partners for that program. But most importantly of all, we're reaching out to the schools and to the community to educate people, parents, and especially the young people about the dangers of these drugs. Our Not My Child forums are taking place throughout the community. We've reached thousands and thousands of people and are educating people on the danger that these compounds represent. Our video, Not My Child, has received national recognition by the National Association of Counties. But despite all of this effort, the problem has only gotten worse, a lot worse. We are now experiencing not 1, but 3 overdoses a day, and not 1 fatality a week, but 2.5. So much worse, which tells us we have a lot more to do. And that's what today is about. This is another important step to do more to combat this crisis. We're kicking off Safe Spaces program here at Station 31. But as the chief mentioned, every fire station in Anne Arundel County and in the city of Annapolis, as well as our police stations, will be safe spaces where people can go and get the help that they need. Here's how it will work. Now that we've designated each of these stations, a person who is suffering from addiction, any time of day or night, can go to that station and get help. Upon arrival, they will be assessed medically to see if there's anything going on that needs immediate medical treatment, and if there is, they will be transported to a medical facility for the appropriate care. If they are not suffering from another medical condition and are suffering only from the drug situation, then they will be given access to detoxification services and through crisis response, all other treatment-related services that they need to recover and reclaim their lives. Like so many other aspects of this crisis, government is not going to solve this problem alone. We need the help of each and every member of the public to let everyone know that these resources are available and that there is help, there is hope. Don't give up. This is going to take a long time. It's a long marathon to win this war against opiates, but we will win it. And this program, Safe Spaces, is another step in the right direction. Thank you again for being here.
I'd like to invite Annapolis City Mayor Pandelides to come up and make some comments.
Good morning. Thank you all for being here. It's another good day in Anne Arundel County and the city of Annapolis, where we're joining together in this partnership to tackle the opioid addiction that's affecting all of our residents of all economic levels. The Safe Streets program is an innovative approach to saving lives and getting drugs off the street. I want to congratulate County Executive Steve Shue and Fire Chief Alan Graves for taking on this initiative for the Safe Streets program in Anne Arundel County. I'm proud that the city of Annapolis is partnering with our police and fire departments to give help and hope to people who are suffering from drug addiction. We gladly join in this groundbreaking alternative to just locking up people and throwing them in jail. And we are grateful that the county will include the 3 fire stations that are in the city of Annapolis as part of this program, the one on Forest Drive, one on Taylor Avenue, and the one on Bay Ridge as safe stations. I applaud the firefighters involved and the young men and women on the front lines who battle this on a day-to-day basis. This is not just an alternative to traditional drug arrest. This is a new lease on life for those addicts and a chance to start over and take charge of their life. There is hope and there is a way forward, and this is one way we're helping the residents. So thank you all for inviting me to be part of this new initiative taking forward. It is now my great pleasure to introduce our state's attorney, Wes Adams.
Good morning, everybody. First of all, I'd really like to thank my partners, Chief Altamari, Chief Graves, County Executive Shu. It's amazing when all of your county agencies step up and work together. And not only are we getting county agencies together here, but we have city agencies as well. And it is really a testament to your local government that all of us can get together in a brief span of time, come together with similar ideas and put something in place that is completely beneficial to our county. Not all crime fighting involves locking people up. It also means giving people an opportunity to safely step away from criminal activity. Our Safe Stations program does just that. My office in particular sits at an interesting part of this rehabilitation or diversion program because many of the people that step into these stations need to know that they can walk away from a life of addiction and the criminal consequences that come with it safely. My priority is reducing crime, and my office's priority consistently looks for innovative ways to do that. It's imperative to do that in the long term, that we look at addiction differently than dealing. The Safe Station program creates an opportunity to do that. My office will support 100% our police officers and our firefighters and their willingness to help the addicted community. We will serve as a resource to help shift the barriers that prevent treatment. In some of those instances, people who wish to walk away from crime have an open warrant, have an FTA, and they need to know that they can safely walk into this station and understand that we will move them along the path to resolve those consequences, but our priority is to get them into treatment. In that regard, my office knows from experience that programs such as these have a positive impact on the community at large. Our drug court program has consistently produced results, and we're using those guidelines to help with this Safe Stations program in order to get people directly into treatment, not wait, and take advantage of the very small window that occurs when a person who is suffering from addiction presents themselves for help. In those unique instances where there is a barrier to treatment, my office will work consistently with not only our first responders, our medical community, but also with our court system and our commissioners to give these people the chance to lay down their needle, to step into treatment. It is through this particular tool that we hope that, as the county executive mentioned, all of our three-pronged approach, attacking the dealers, working on diversion and rehabilitation, and helping rehabilitate persons suffering from addiction, that those people will have an opportunity to thrive, recover, and can answer the call of hope. I am proud to stand here today with every one of these members of your county government and your leaders in your community to help make this program come to life. Thank you. I now have the opportunity to introduce my great partner and our police chief, Tim Altamari.
Thank you, sir. Good morning, folks. Thanks for coming out. Today is about another step on a journey that's about more than mindset, it's about heart set. The conversation about amnesty moments started in the county 2.5 years ago when Mayor Panelides and County Executive Shu looked at the leaders you see at the front of the room here and said, business as usual ain't getting it done, folks. We've got to figure out how to be better at fighting this monster that we're fighting. We've got to get better at offering alternatives. We've got to get better at talking to people. And so when the conversation started 5 or 6 months ago about these amnesty moments, and let's be honest, that's what we're talking about here. We're talking about giving an amnesty moment to a person who's struggling with something that they can't beat themselves, and they need a helping hand. So the amnesty moment makes total sense for the person who is coming in here looking for help with the addiction. There are people who are going to be watching the news tonight, looking at the cameras, in the middle of the throes of this struggle. I'm here to tell you, if you're looking for the help, we have the help for you. We can't walk the whole marathon for you, but we can help you take the first few steps. You have to be able to set aside, just as the police have set aside, the mindset about an adversarial relationship. We're here to get you help if you want help. If you have gel caps you want to get rid of, and you have needles at home you want to get rid of, and today's the day and you're ready, and you bring them to us, it's freebie day. We're here to help. We're serious about it. We are so thankful for our treatment and education partners for partnering with us. And here's hoping this gets us another step forward. We haven't hit the high water mark on losing people yet. I'm hoping this helps us get there quickly and start to take real effective steps to bring our numbers down and to save more lives in Anne Arundel County. We're in it all the way, folks. Stay in it with us. Thank you very much.
We'll be happy to entertain questions.
Can you describe some of the training that the fire EMS will go through as a result of the safety stations programs to facilitate that? Yes.
Okay. My name is John Wendell. I'm the medical director for Anne Arundel County Fire Department. As far as the training that they'll undergo, it's training that they already have. So when someone seeking help comes to one of our stations, they're going to receive a medical evaluation similar to an evaluation that happens every day when our paramedics or firefighters come to a house. They'll look for signs of severe withdrawal, look for other medical illnesses that could complicate the rehab process. If someone has signs of severe withdrawal or other medical illnesses, they'll be transported to a hospital for further evaluation. If none of those signs exist, then our crisis response team will work closely to evaluate and get them the resources that they need.
Any other questions?
I'm not familiar with the Vivitrol, I believe it's called, and the treatment that County Executive mentioned. Could somebody educate me on that?
Hi, good morning. I'm Dr. Chan. I'm the health officer with Anne Arundel County. So Vivitrol is a long-acting opioid antagonist. What that means is that it essentially, it's a depot, so it's actually injected. It's a once-a-month injection, and it sits there and it sort of slowly disperses into the body and actually counteracts the effects of opiates like heroin, oxycodone, and others. What we have done for about the last year and a half is a Vivitrol program in the Ordnance Road Correctional Center up here in Glen Burnie. And so we identify inmates who have substance use disorder and are eligible and interested in Vivitrol treatment. And so about a week or so before they actually are released, they are injected, and then they follow up in our clinic, and we provide the ongoing injections, and we also provide counseling. Our very first patient is still with us about 18 months later.
Any other questions?
One more.
Sure.
Will there be any coordination with the upcoming stabilization center or in hospital in terms of transport patients for the medical evaluation?
Jen?
So currently, that's in the works. They're not deemed right now as an emergency facility, so what we will have to do is look at the medical piece first and the clinical piece, and then decide the appropriate placement. They are actually a crisis bed, so that is something that once the clinician who comes out to either the hospital or the fire station, once we look at that piece, we will see what the appropriate placement is. That's the whole point of assessing, is to see where they are in their readiness for change and then determine which treatment will be appropriate for them. That's a step that we're looking to in the future, but it's not kind of been tidied up yet.
Okay, and that was Jen Corbin, and she's the Director of the Crisis Response Services. Any other questions? Okay, we thank you for coming out this morning. Most of the panel members will be available if you have questions for them individually. And again, thank you for coming.